Most people think that cancer risk is mainly down to genetics or bad luck, but as a doctor, one of the clearest and most overlooked risk factors I see is excess body fat. Not just body weight, but what fat tissue actually does inside the body over time. So in this video, I'm going to talk you through 5 reasons losing body fat reduces cancer risk. And if you stick around to the end, I'll also explain one bonus reason that often surprises people because it shows that cancer risk can still improve even later on in life. Number 1, one of the main reasons losing body fat reduces cancer risk is by lowering chronic inflammation. Excess body fat releases chemicals that keep the body in a state of long-term, low-grade inflammation. Now, over time, this inflammation damages cells, DNA, and increases the chances that abnormal cells survive and grow. This is why cancer risk isn't about sudden changes. It builds quietly over years. As body fat reduces, inflammatory signals fall, and the internal environment becomes less damaging to cells. Number 2, losing body fat reduces high insulin levels that can fuel cancer growth. When body fat is high, insulin often stays elevated. Insulin doesn't just control blood sugar, it also acts as a growth signal. High insulin levels can encourage cells, including cancer cells, to grow and divide more easily. This is one reason that cancers that are linked to obesity are often more aggressive. As body fat reduces and insulin sensitivity improves, these growth signals become weaker. Number 3, losing body fat helps to rebalance hormones linked to certain cancers. Fat tissue actively produces hormones, including estrogen. High levels of estrogen are linked to increased risk of hormone-sensitive cancers such as breast, endometrial, and prostate cancers. This effect isn't limited to women. It happens in men too. Reducing body fat helps to normalize hormone levels, lowering cancer risk over time. Number 4, losing body fat improves immune surveillance against cancer. A healthy immune system constantly identifies and destroys abnormal cells before they cause any harm at all. Excess body fat impairs this process, allowing damaged cells to survive when they shouldn't. I see this so often in patients who are frequently unwell or slow to recover. As body fat reduces and overall health improves, immune function strengthens, improving the body's ability to detect and clear abnormal cells early. Number 5, losing body fat reduces the risk of several common cancers. The important point is that this risk is modifiable. As body fat reduces, cancer risk falls even if weight doesn't reach a so-called ideal number. And here's the bonus reason I promised earlier on. Cancer risk begins to improve as soon as metabolic health improves, not only after major weight loss. I often see people assume it's too late to make a difference, but improvements in inflammation, insulin sensitivity, and immune function begin early in the fat loss process. This means that reducing cancer risk isn't about perfection. It's about improving the internal environment your cells live in. So, the bottom line is this. Losing body fat doesn't just affect your appearance or your confidence. It changes inflammation, hormones, insulin levels, and immune function. All of this influences and reduces your cancer risk. The good news is that cancer risk can fall as metabolic health improves at any stage. Dr. Derek here. If you found it helpful, please leave a like and subscribe. And as always, I truly care about your health and I wish you the very best.